Hey, good morning and welcome to Euronurse News. Today we're taking a closer look at a major development in federal drug policy, one that could significantly impact medical research, patient access, and future healthcare decision-making. President Donald Trump has signed an executive order directing the federal government to reclassify marijuana as a Schedule III substance. This move marks a major milestone in American drug policy and places the administration squarely between two long-standing camps, those pushing for expanded medical research and those warning of public health risk. Under the new classification, marijuana remains illegal under federal law. However, a Schedule III status could make it easier for researchers to study cannabis and its potential medical uses. Schedule III drugs are considered to have accepted medical uses and include medications already common in healthcare, such as certain opioids and anxiety treatments. In contrast, Schedule I drugs, where marijuana has been classified for decades, are defined as having no medical benefit and face the strictest research barriers. At the Oval Office signing ceremony, President Trump framed the decision as a response to patient demand. He said the action has been requested for decades by Americans suffering from severe pain, cancer, seizure disorders, neurologic diseases, and chronic medical conditions, including veterans and older adults. Standing behind him was Dr. Nora Volkow, director of the National Institute on Drug Abuse, an appearance that underscored the administration's focus on research rather than legalization. The president also cited public opinion stating that marijuana rescheduling polls at 82% approval, calling it one of the most requested issues he's heard from voters. But he is also clear on one key point. This order does not legalize marijuana and does not sanction recreational use in any form. Still, criticism was swift. The advocacy group Smart Approaches to Marijuana called the move a public health disaster, arguing it could encourage increased use, particularly among young people. The group also warned that reclassification could provide major financial benefits to the cannabis industry, including access to standard business tax deductions that were previously prohibited. They've indicated potential legal action if the rescheduling process is finalized. Big surprise? I don't think so. And that's an important point. This executive order does not immediately change marijuana's legal status. Instead, it directs the Attorney General to expedite a formal rescheduling process, a process that still must move through both the Department of Health and Human Services, as well as the Drug Enforcement Administration, the DEA. That process began in 2024 but was never completed. The order also directs HHS to develop new research methods designed specifically to measure cannabis's potential benefit, or something many scientists have long called for. However, administration officials declined to provide a timeline for when the process or new research rules might be finalized. The announcement also included new developments around CBD, the non-intoxicating compound found in cannabis. President Trump expressed support for CBD-based products, often used for seizure disorders and other conditions. In a notable move, Dr. Mehmet Oz, administration of the Centers for Medicare and Medicaid Services, announced a pilot program that could allow some Medicare beneficiaries access to CBD products at no cost, if recommended by a physician as early as April. That comes amid an ongoing debate over federal hemp regulations, which could affect the future availability of non-intoxicating cannabis products. Despite the symbolic weight of this decision, experts caution that it may not dramatically change access to marijuana in the near term. Cannabis remains federally illegal and continues to be regulated primarily at the state level. Dr. Nora Volkow struck a measured tone during the event, acknowledging potential benefits for some patients while warning of known risks, particularly for adolescents. She noted that while cannabis can be addictive, research, not assumptions, will ultimately determine how to maximize benefits while protecting our most vulnerable populations. For healthcare professionals, nurses, and educators, this move may open the door to better data, clearer guidance, and more informed patient conversations. but it also underscores the need for caution, evidence, and ongoing education. We'll continue to follow this story as the rescheduling process unfolds and as new research initiatives take place. Concierge medicine and direct primary care are growing fast. But how fast? And why are patients and clinicians paying attention? Tomorrow, I break it down. The real numbers, the forces driving this shift, and what it means for nurses, urology practices, and patient-centered care. So if you've been wondering whether membership-based medicine is a trend or the future of healthcare, you won't want to miss tomorrow's episode hosted by yours truly. New episodes drop tomorrow on UroNurse News. As always, shared decision-making and clinical judgment remain key. I'm Vic Senese, and this has been UroNurse News, bringing you evidence that informs practice, and don't forget to like and subscribe.
UroNurse News, we've got the scoop, helping you stay in the healthcare loop. From Monday to Friday, we bring the view.
UroNurse News.